Zoll AED Plus testing PM, say whatever. Similar to most of the AEDs in the market. This is one of the best AEDs in the market simply because the pads come with a there's a feature between where the two pads attach to the patient where you actually do CPR. All AEDs now tell you the timing. They tell you when to do CPR, when not to do CPR, etc., etc. Well, chest compressions, really. This one has a pad that tells you if you're doing the chest compressions at the correct rate and if you're pressing hard enough or too hard, which is why I say it's one of the best AEDs in the market. Its only downfall is these stupid batteries only last for a few tests before they, burn out. And you can get these at like a drugstore for $100, or some places sell them for like $60 for a pack. So now on with the checks. So this is our ECG analyzer, ECG defib analyzer I'm going to use, the Fluke Impulse 6000D. I do not have the pacer function on this one, but we don't need it for this test anyway. So first thing is checking your pads. Check the pads date, not expired, that's good. Check the battery dates. These are brand new, so also good. Now we have an X because this is fresh out of a box, has never been tested. Anyway, let's take a look. I probably have to install the batteries in this. Just got to pry these two tabs up. Open the battery door. Sorry, there we go. Yeah, well, not gonna work without batteries. All right, batteries are now in. So first thing, I gotta press this button down here.
Plug in cable.
Let it know that it's got new batteries. That's just your little reset.
Plug in cable.
Otherwise, you're gonna get replaced batteries or install batteries.
Plug in cable.
All right, let's pop this lid off.
Plug in cable.
Now, I'm not gonna take the new pads because once I open it, they're no longer sterile and lots of pain. But we have a rig, so.
Plug in cable.
All right, shut up. So this is what you're using. You can use this on every Zoll defib AED ever. So this half here with these two pins is what you plug into any defib cable. This over here is how the AED knows if these are pediatric or adult, and just a little resistor that's in here. If you ever see the pediatric, you'll see it's just the wires in two different spots. Easy to bypass if need be. For testing only, not for use. So plug it in. I'm set up here. Obviously, I don't need the sticky pads. That would be stupid. It'd be hard to, store in my PM kit, and eventually the sticky would wear off, and then what? So you just cut the ends off, splice it, and just stick it in the hole, and put the metal plates over to hold it so it's got a good setting. Now, I want this to shock, so to go VFib. AEDs will only shock in ventral or aortic, I think that's it is, fibrillation, AFib or VFib. So we're in, we're on. Just gonna run through its stuff here.
Adult pads.
See, adult pads.
Automatic defibrillator.
There are
Unit
peds, it would say
okay.
peds. Anyway, now we're gonna run into it.
Don't touch patient. Analyzing.
Analyzing. Yeah, I know, I'm Beavis and Butthead. I'm 12 years old.
Don't
Anyway.
touch patient. Analyzing.
So let it finish analyzing. I cannot stress
Don't
the
touch
do not
patient.
touch
Shock
the
will be
patient
delivered
enough.
in 3, 2, 1. Shock delivered.
That's
Start CPR.
the models, the older software before this, it tells you, okay, press the shock button, which is this right here. This is the latest
Continue
revision
CPR.
for the Zoll software, so it does its own shock. So you don't, to help stress, get the fuck away from the patient. Do not touch the patient. I cannot stress that enough.
CPR.
Sometimes they have the software revision on the back. Philips does that. I don't see anything.
Continue
I
CPR.
don't know. If you know or see it, let me know. Maybe it was in the boot up. We'll find out when we restart again. So we've already verified that it will shock. So let's go back to normal
Continue
waveform.
CPR.
So I wanted to know that there's no need to shock. So it's going to take about 2 minutes.
Continue CPR.
30 compressions, 2 breaths. You just keep doing that. Now the whole point of an AED is, or even a
Continue
defib,
CPR.
we're not starting the heart, we are restarting the heart. So when the heart is beating at the incorrect rhythm, you know, like somebody at karaoke poorly singing a song,
Continue CPR.
you need it, you know, you want to restart it. So we jump it or we shock it to stop the heart, and the heart comes back on its own,
Continue
and
CPR.
hopefully is then beating at the correct rate. You know, suddenly your karaoke star with the terrible voice suddenly got better, and the song sounds so much
Continue
greater.
CPR.
So the heart is now pumping and working correctly. If the heart is not beating, this is not going to help you. That's when you're doing CPR
Continue CPR.
to continue. Son of a bitch.